With natural cycle IVF, we see that that's beneficial for patients that have diminished ovarian reserve, have a low AMH or a high FSH, and are basically told that they can't do IVF using their own eggs because they don't have any eggs left. Natural cycle IVF allows us to manipulate the FSH level by using estrogen and lowering the FSH level and allowing the body naturally to grow 1 or 2 eggs. Because if you think about it, the stimulation that's given to patients is FSH, primarily giving them hormones to try to stimulate the ovaries to grow more eggs. If the patient's FSH is already elevated, let's say 15 or 20 or even higher, giving more of the medication is not going to increase the egg number. And it may have a detrimental effect where it downregulates and causes no egg development, and certainly it can have a detrimental effect on quality. By doing so, we're able to get the eggs that otherwise would be suppressed and never release, and give them an opportunity for pregnancy using their own eggs. At the other extreme of the reproductive potential, it's also excellent for a patient that's, let's say, under the age of 30, that may have her tubes blocked and has plenty of egg producing potential and wants one baby and doesn't want to undergo injectable hormone stimulation or manipulation of her cycle. We know that if we can have her produce 1 to 6 eggs, and in patients with natural cycle, I've had as many as 6 eggs that I personally have retrieved in those patients. So we often get 1 to 2 eggs, but occasionally we can retrieve more. And we're basically allowing the patient to stimulate the growth of her own follicles, and then we retrieve the follicles and the eggs when they're ready. We also have some patients that have estrogen-dependent tumors, like breast cancer, where they're concerned, or their oncologist is concerned, that being exposed to a supraphysiologic or high dose of estrogen could have a negative impact on their overall cancer survival. So that's where natural cycle IVF could hold a lot of hope for those patients as well.